Happy Friday, Baylor College of Medicine and friends of Baylor. Well, you know, it had to happen. Delta Airlines has announced its Delta Plus service. And I was lucky to get a very quick peek of that. And it turns out they're now putting face masks actually on the airplanes as part of the Delta Plus service. So you may be asking yourself, what does the United States, United Kingdom, Botswana, Iran, Malaysia, Kazakhstan, and Mongolia have in common? We're all hotspots. That's where we are now amongst the hottest spots around the world. And so, I like to look at other countries that are a little bit farther ahead of us in the vaccination world. And Israel and the United Kingdom are ahead. If you look at, they're up to about almost 60% of their population, whereas the United States is just at 50%. Of course, poor Botswana just started their way. They only have less than 10% of their population vaccinated. But the reason it's worth looking at the United Kingdom is because they've had a pretty significant outbreak of Delta virus, even though 61% of their population is vaccinated. And so the thing I was saying last week that I hope for, if we're lucky, maybe we'll go up really fast and come down kind of fast. I don't know what's going to happen, but we're all praying that's going to happen. Israel has had a remarkably big peak. Even though they were down to about 5 to 10 cases in their country each day, they're up to about 7,000 cases. But most of those cases are being driven by the unvaccinated. Remember, they're at 61, 62%. That means that 30 to 40% of their country is not vaccinated, and kids. And so, with this virus being so much more infectious, it's going to find the folks that are not vaccinated. So how are we doing in the U.S.? We're at our highest rate for the last 6 months because of Delta. And the good news is that vaccines remain effective. We're up to now 700,000 vaccines a day. I think it's scary enough for people in the unvaccinated communities that are beginning to do more and more vaccines. But interestingly enough, even in those states that are pretty good, like Oregon and Hawaii, they're beginning to see a surge too. Now, it's not as bad as the ones that are in the South, but it's still pretty significant. And in the upper Midwest and Northeast, they are seeing increases too, but at a rate that's much, much less than the rest of the country. But if you look at the nationally, we're certainly in our big fourth wave. And even though the Biden administration claimed that we're 70% of the way there, actually not. We're 59% of the total population that's had one dose, about halfway, 50% that are vaccinated. And as a result, we're over 100,000 cases a day. Many people are predicting we'll get potentially to 200,000. Lily, you can't be eating that. I
thought you gave her a snack.
No, she's eating. There's a little thing that says vaccinate now, and Lily found that incredibly delicious and delightful. It's from a spice company. Stop eating the spices, Lily. Jeez. Anyway, so we're up to over 100,000, almost 130,000 cases a day, and we're having about 650 deaths a day, which is really a shame. Now, each week, I say, let's look at the hot spots. Well, this week we'll do it differently. Let's look at the places that aren't so hot. So Wisconsin, Minnesota, Michigan, most of the Northeast, they're actually really doing very, very well. And of course, they're the states that are most vaccinated. The places that are really on fire are Louisiana, Mississippi, parts of Alabama, and Florida. So again, it's those states that have the least vaccination, and of course, Texas. We're making the news, more national news, because we have so many people who are infected in Texas. And here's our surge. We're almost to the peak levels we were in the third wave. So Texas has now had over 13,000, almost 14,000 cases a day this past week, over 150 deaths. And of course, we have hot spots. You're not going to guess. I'm going to give you a hint. There's a county that begins with a D. Our friends in Dimmitt County, they remain up there, and now Webb County. Galveston seems to have cooled off a bit. And I remind you, if you look at the Texas data from the past, here's the peak, but about 2 to 3 weeks later, you can see that the next peak is for hospitalizations, and then about 2 weeks after that, it's death. So when we're peaking now, we can anticipate hospitalizations will peak in a couple of weeks, and the deaths will peak 3 weeks from now. So I'm always looking for something to give some good news. Well, the Texas Medical Center has been following our data in the 9-county region, and we've been looking at 7-day averages of cases per day. And we peaked in the winter at 4,282 cases, and this past week we're at 3,318. But the good news is we've come down. We're down to 2,870. I don't know if that's like the United Kingdom, that we're going to have a rapid fall, which would be awesome, or is it going to do like they did, drop a little bit and hang out? We just don't know. And if we turn to the Institute for Health Metrics and Evaluation, the good news is if we might be peaking now. That's the best case scenario, that purple line, if we might be peaking now. Now, the worst case scenario, of course, is we peak in October, and then we'd have a whole nother month of this. So most of the questions I get now around school's opening up, and masks. Are masks really useful? I was watching TV and heard a particular politician stand up and say masks do not work, and why? Because those viruses are so small. Viruses are smaller than all the holes in the mask, so how can it possibly work? Well, you add to the confusion, there are some states and cities that have now reinstituted mask mandates. Some states have made mandates impossible for masking. Some cities have vaccine passports, others do not. Some are implementing more physical distancing, others are not. And so I would ask you, if you were the virus, where would you want to go? I'm going to the place where there's no masking, no physical distancing, no vaccinations. Well, that's, the virus is going there. That's where it is. So I'm going to have to go back. I hate to do this because this is a year old, but do masks work? Since a lot of people are saying masks don't work, do masks work? Well, there's 3 levels of scientific evidence to support it. One is that you do it in the laboratory. You watch how many particles go in, how many particles come back at you, and do the science in a lab. The other way is to look at epidemiologic data. What happens in outbreaks, go investigate them, who had masks and who didn't. And then the last piece of data is you look at population studies. We implemented a mask mandate. What happened after that? So let's look at a sneeze. I hate looking at sneezes, but that's what a sneeze looks like. You eject particles out, somewhere between 3 and 6 feet. And the larger particles above 10 micrometers fall to the ground, either on tables and surfaces. That can be fomites. Or if they're small, below 10 micrometers, they float. They stay aerosolized. And that's we found now that, a lot of the transmission is through aerosolization. And how do we figure that out? Remember the choir singing away? Well, loud singing actually generates more small particles than anything. That's the dots in blue. Normal singing, also loud talking. The third largest ability to put aerosols in the air. Remember the outbreaks in the meatpacking industry. Lots of loud talking, screaming over the equipment. And even breathing does, but it's relatively small. All these are generating aerosols, small molecules. So what about the people who say, well, the viruses are so small, no mask is going to protect them? Well, the cool thing, or the interesting thing, is that viruses don't just hang out by themselves. They're encased or attracted to water droplets. So they're actually particles that are viruses in water, mucus, other secretions that come from you, and that's what is floating out there. And those particles are in the size that actually can be removed by a mask. Now, most people think of masks as filters, like an N95. The hole's got to be small enough for the little tiny viruses to get stuck on, but that's not how they work. They don't act like a strainer. They have a lot of overlapping fibers that make it a very high likelihood that a droplet will come close to one of the fibers. And these droplets are charged. They're charged particles. Water is charged. And so they tend to have an electrostatic sticking force to these fibers, and that's how they're removed. It's not because they're filtered out physically, it's because they're electrostatically attracted to the fibers. That's why they are effective. And N95 actually refers to the percentage of middle sort of molecules, below 10 microns, around 3 to 5 microns that are removed, and 95% of those are removed by an N95 mask. The interesting thing is, other masks work well. So this is a bandana, doesn't work so well. This is a surgical mask, works really, really well at preventing projection of particles. And there was an assessment that was done by published in the CDC, looking at various masks and their ability to control the amount of viruses that are exhaled. And what you can see is that in the green bars, just wearing a face shield does not work, but wearing an N95 in the blue bars is very effective. Interestingly enough, multi-layer cloth masks, surgical masks were also very effective. So they're not 95% effective, but they're 50 to 70% effective. So you're removing 50% or 70% of the particles by wearing a mask. There have been some studies. There was a study done in the Journal of Aerosol Science and Technology in Brazil. They looked at 227 different face masks. And the way they did it was they used sodium chloride particles, salt, in the range of sizes that were actually smaller than a single micron, so really tiny particles. And what they showed was that the N95 was very effective at screening out those particles, but so were non-woven cotton and surgical masks. And even homemade masks with multi-layers of cotton were about 50% effective. So masks are very effective at preventing you from pushing out particles to other people in case you're infected. Well, what about screening particles once they come in? How does it protect you? Remember early on we said where to be a good citizen. Well, then there became data like where to protect yourself. So there is effectiveness of face masks to screen out particles. Of course, N95 again is the gold standard. But a washed two-layer mask, especially a nylon mask that is charged, with a metal nose bridge that's highly effective, can remove 80% of the particles. So you can protect yourself by wearing a well-fitted mask. The key, and the EPA showed this, is to wear a well-fitted mask. And there was another industry study just looking at a company that was making multi-layered cloth masks. And what they showed was that you could reduce by 70% the amount of particles that were inhaled, with an N95 being 95%. But if the key thing is if you're wearing a mask and another person is wearing a mask, you can reduce by 99% the particles that are being inhaled. So people wearing masks, if everyone's wearing a mask, it is highly, highly efficient at protecting people. And we've seen that. I don't know why we have to repeat it, but we've seen it. We've seen it in practice. So the epidemiology, that's the laboratory-based stuff. What's the epidemiology of physical distancing and masks? So there was a great study. It was a meta-analysis. Those investigators looked at 172 observational studies in healthcare and non-healthcare settings, 16 countries and 6 continents, over 30,000 patients. And they looked at COVID-19, SARS, and MERS. Specifically did not want to include flu, just looked at the coronaviruses. And what they showed through this meta-analysis, that you can reduce transmission between individuals by 82% at 3 feet distance and 91% at 6 feet. So physical distancing actually works. There's been a ton of studies, and what I like is I'm reviewing stuff we reviewed a year ago, but because people are debating it again, we're going to bring it up. But remember the USS Teddy Roosevelt, 382 U.S. Navy service members were infected. So they went back and asked, it's an epidemiologic study, they asked the people who were infected, they said, were you wearing a mask or were you not? All the people on the ship. Well, it turns out wearing a mask reduced the risk of infection by 70%. There was that great study that was published in MMWR about implementing a universal mask mandate in a particular town, and there was a hair salon. Remember the 2 symptomatic infected hairdressers and 139 patrons. They were both wearing masks. Not a single patron was infected. There was a study, contact tracing in Bangkok, Thailand. They looked at 839 close contacts of 211 cases. Using a mask, as reported by the individuals, reduced infections by 77%. There was a population study where they looked at a city that was implemented a mask mandate. And mandatory mask wearing in public was followed by a decline in the case number. There was a study in the Boston healthcare workers in April of 2020. Using universal masking of patients and healthcare workers led to a decline in the diagnosis of COVID in the hospital. And there have been U.S. population studies from last year that looked at mask mandates in communities where they decreased the number of cases by over 6%. So, every possible piece of data really shows that. And probably the best study that's relevant to all those people sending their kids to school was a study done last year by the ABC Science Collaboration in North Carolina. So this was implemented in August of 2020, a year ago. There were 56 of 115 school districts in North Carolina joined the collaboration. 11 of those 56 were open for in-person school for the first 9 weeks, and they agreed to track infections with their local health departments. So it's 90,000 students included in 11 districts, and they were K through 12. And during that 9-week period, there were 773 acquired infections. Only 32 of those 773 were acquired in schools. So there were 6 in the pre-K, 11 in elementary schools, 6 in middle, 5 in high schools, and 4 in the K through 12 schools. Most were in 3 clusters that were actually done during lunch, special needs kids, or people not wearing face masks in school. There was no incidence of child to adult transmission, and that what they used was what we knew to use: mask wearing, physical distancing, hand hygiene, and surface disinfection. If you look at the other communities, the other schools that were not included in this, there were more outbreaks in private schools, charter schools, and home schools. There were, in 150,000 kids, there were 191 cases, most related to lack of face covering. So, I don't know how to say it. Get vaccinated, and if you're not vaccinated, wear a mask. Practice good public health measures. We keep saying it over and over again. And, kids remain a low risk group for hospitalization, but they've never been at higher risk than they are right now. So before we end today, let's just sort of review some facts, what we know and what we don't know. So, what we know that the vaccines work to prevent serious illness, hospitalizations, and death. And the trials are about 95% efficacious in preventing symptomatic disease. We're beginning to see breakthrough infections. None of that was unexpected. And no vaccine provides perfect immunity. We know that. And so 10 to 15% of the people who are vaccinated are going to get sick. But it reduces the time of being sick, and it prevents you from going to the hospital and dying. And there's a ton of data that support that. This summer, the CDC reported 35,000 deaths from COVID. Just 1,100 of those were from vaccinated folks. In other words, 96.7% of deaths this summer have been in the unvaccinated. And in almost every state, more than 95% of the hospitalizations are in the unvaccinated. So it's real clear we should be doing this. There is one, we know now, because the Delta virus is so infectious, that even in high-risk groups, there are going to be reinfection, or there's going to be breakthroughs. And so there's a retirement community in Florida where almost 90% of its population of over 65-year-olds was vaccinated, and they just saw a surge in cases and hospitalizations. And what we're seeing there is probably that they were the first to be vaccinated, and that is why the FDA and the CDC are likely to approve booster shots beginning in September 20th. I think that's really, really clear. So lots of interesting stuff. The concern continues to be about long haul syndrome. We don't know the impact of that, and when we find out, I'll be able to talk more about that with you at some other time. So I want to end today with some shout outs. First of all, I want to shout out mainly to Shirley Hutchins, who convinced her recalcitrant son to get vaccinated. Remember, I talked about the Kaiser Foundation data. One of the things that influenced people to get vaccinated was nudging from a family member. So great nudging by Shirley Hutchins. I also want to thank the Atlanta Falcons and shout out for them, first NFL team to get all vaccinated. And this week, I just want to remind everyone we had a great white coat ceremony, very important ceremony in the professional career of a physician. That's the point where you enter medical school. We put a white coat on you and remind you how important it is to be a professional physician. We certainly need them now, but it's also the weight of the responsibility. And I was very pleased that, of course, Lily participated, and she understands the importance of being a dachshund related to a physician. So, like everybody, she takes her responsibilities very seriously. So, have a great weekend, and I can't wait to see you next week.
And now for the moment that you've all been waiting for, the donning of the white coats.
You may now don your white coat.